So, a short summary of the topic of my presentation. Rx-to-OTC switch, taking a drug from prescription to non-prescription, is one of the key drivers of the OTC industry. About half the major brands have come from prescription to over-the-counter. That has been the biggest way of growing an OTC business, apart from acquisition, in the last 30-40 years. The challenge at the moment is that the next generation of switches are harder to do, and so they have somewhat stalled and innovation has been slower. What we've been looking for is ways of restarting that, enabling consumers to select and use more complex products, and we believe we can help with that, and we believe we can work together with the industry to move Rx-to-OTC switches forward faster again. The key message that I'd like to say to the OTC industry is that business models are changing, consumers are changing, and we can change with them. And if we can change with them, we can bring innovation in a way that's never even been seen before in the industry. Consumers are now very comfortable with technology. They buy things online, they search for things online. But with OTCs, they are largely walking up and down a long and confusing aisle looking for products. We can revolutionize that, particularly with future switches, which are more complicated to select and use. We can use technology to make that purchase decision easier by linking consumers with their own personal healthcare data to make sure a product is right for them and working for them. The key takeaway points I see from this conference is that the industry at the moment is in a situation that it has to get out of quite quickly, and that is that it has no growth. The volume growth of the OTC industry in terms of the volume of consumer brands sold is round about zero. The dollar growth is about 2%. That's not a good situation to be in. The threat which is posed to the branded industry by private label is getting greater because private label products are adding value, they're making more profit for the stores, and they're increasing their share. And that's not a good position to be in unless you can have continuous and relevant innovation in the branded industry for the consumer. I thought the overall conference was realistic. It faced up to the issues that are challenging the industry. I thought that we were talking about the right approach to solutions. This is difficult because it means changing the business model somewhat. Consumers are becoming more diverse in their behavior. Shopping online, searching online, looking for information online, even going to the doctor online. They're getting medical support from new points of care. Things are changing and the industry has to change with them. They have to change their business model. I thought at last we were confronting the issues, or beginning to confront the issues and looking for real solutions.